Loud, perfect. Perfect. Hello, everyone, and welcome to today's live session with Dr. Sarmila Sinha today. I am very delighted to introduce this incredible consultant who is bringing the answers to stress management for all of us. Dr. Sarmila Sinha is a consultant psychiatrist with more than 15 years of work experience in the NHS, managing and treating stress-related mental illness. She was a health and well-being ambassador for doctors within the NHS. She has the knowledge and expertise in stress, its effects, and has developed a unique and simple way to manage stress known as the 4C approach to stress management. Dr. Sinha is an international speaker on stress and is a best-selling author. Her latest book, An Expert Guide to Stress Management, was a #1 bestseller on Kindle, Amazon in 2019. Dr. Sinha is the stress management trainer for the British Society of Lifestyle Medicine, and the next stress management training course is on the 18th of September 2021. And we'll be talking a little bit more about that and how you can get involved. Welcome, Dr. Sinha. Thank you very much for joining me today.
Thank you so much for having me. It's my pleasure to be with you today.
You have done incredible work for all of us to see how we can manage stress. And more than ever during the pandemic right now, we have to learn practical steps on how we approach our own stress and those of our patients. And I would love to hear a little bit more about what got you to address this issue and find this very practical approach.
Thank you. It's an excellent question. As you mentioned, I was with the NHS for more than 15 years treating mental health conditions. But what I found that most of the mental health conditions, when patients come to me, the trigger is usually stress, which takes them over the edge. So the stress can manifest in different ways. So as we all know that stress is nothing but our body's reaction to threats, or these could be perceived threatening events, or this could be real events, but the mind doesn't know the difference. We could be fearing for the worst, we could be worrying about what's going to happen, what's going to happen wrong in our lives. And especially during the pandemic, stress has been a big factor, which has actually led to increase in the rates of depression, anxiety, OCD, and so on. So while I was working with my patients, I saw that stress has been a precursor. So if people had more awareness on how to manage stress, if people had more awareness on recognizing stress, knowing the symptoms of stress, and finding the right balance on how to manage stress, lead their lives, especially using lifestyle medicine, lifestyle psychiatry. We have lots of tips on your website on British Society of Lifestyle Medicine. If people are more aware of these things, then they can actually prevent mental health problems. Like they can prevent an episode of major depression. They could prevent many mental illnesses. Sometimes due to genetic factors, mental illness cannot be entirely avoided, but what we can avoid is the intensity, the severity of relapse.
And it's super important, as you mentioned, to kind of identify it even before it becomes symptomatic, to understand our environment and how that causes stressors on our lives. Is there a practical example where you can share a patient story where you have been able to identify these stressors around their lives to support their well-being?
Yes. So especially at the time of the pandemic, I think work, redundancy, financial issues, lack of job, relationship problems, all these have been a big factor in stress. So which has led to relapse of mental illness, or even putting on the edge of depression. So there are lots of examples, like people could be going through relationship difficulties, people could be going through financial difficulties, and they don't know how to address these issues. And because they are struggling, people take the help of, they self-medicate by using alcohol, by using drugs. And some people also, there's a bit of stigma around approaching for help. So people are battling this on their own. So if we can address this, so I have had patients where They've told me that they can identify, actually people can identify the triggers, they can identify the stressful event in their lives. So when these things happen, then it's very important to identify them at the early stage rather than leave them till the end. So what I always tell my patients is that try to recognize, try to find out what is causing stress. Keep a mood diary, keep a diary of events, keep a journal. It's very important to reflect on what's happening in our lives, because we lead very busy lives. We are just rushing. But if we just take a couple of minutes from our 24 hours just to reflect on what's going wrong in our lives, we get a lot of answers there and then.
Absolutely. And the diary approach I found really useful, not only for myself, for the patients as well. But you did mention that you have this 4C approach, stress management. Would you highlight these 4Cs and how our listeners could use them in their daily life?
Yeah, so I developed this very simple 4C approach. It's called calm, clarity, choice, and change. Now, you don't have to go through therapy, you don't have to go through many weeks of treatment or anything, but these you can apply at any stage of your life, whether you're experiencing stress or whether you are anticipating a stressful event like a job interview, or maybe you're not happy with your job, you want to change. So you can identify any upcoming event and you can apply this 4C. So the first step is calm. So the first step talks about when we are faced with a stressful situation. It could be an email which is stressing us out, or it could be an unfortunate event, or it could be a bad news. So when we are faced with stress, the first thing to do is to take a step back. Now, the words taking a step back means not reacting, not having a knee jerk reaction. So you could do many strategies. You could take a few deep breaths. You could count to 10. You could just leave the room. Like if you're at your workspace, at your desk space, and you get a phone call or you see an email, rather than rushing to uh, write back or rather than reply back, just take yourself out of the situation, go for a walk and then come back. So that is calm. The next C is clarity. Clarity means understanding the situation as it is and not imagining too much, or not putting too many, not magnifying the event. Because what happens, our mind is an amazing thing. It can actually take us to a dreamland. It could let us daydream, but at the same time it can also visualize or make us imagine the worst possible scenario. So when we are faced with stress and there is a particular event, rather than indulging on the, what if, but if we just look at the event as it is and then try to get some objective and real information. So this could be information gathering. So for example, if you're in a position of a manager at a workplace and you get a complaint about one of your staff, rather than going into conclusion about what the issue could be, what the manager could do is get a 360-degree approach, get feedback from different staff members, get feedback on what the issue is, and be neutral about it. And that is clarity, just to look at more information. The next step is choice. Choice is actually about empowering ourselves. Like when we face with stress, we feel a sense of helplessness, that everything is over, there's nothing is in our hands. But choice actually enables us to take back the power, that we always have a choice on how we choose to react. We can choose to be angry about a situation, we can choose to lash out, we can choose to be sad, be depressed. We always have a choice on how we react. Now, the choice also implies taking ownership of life's decision. For instance, somebody is not happy with their job and they want to move on to another job, or they want to change career. So choice actually enables them to consider the pros and cons of the decision. And whatever the decision is, that they own that decision, they own the choice. Because every step, everything you do in life has some pros and some cons. It's about empowerment, it's about knowing that your choice is your own. And actually, that takes us away from the victim position and being actually in control of situation. For instance, if you don't like your job, but you're in a job just for the sake of money, you don't have to feel helpless about that situation, because it's your choice. You are doing this job because you need the money. So you have actually chosen to be in that situation, and you can get yourself out anytime. And the next step is change. Change doesn't come overnight. So when you apply calm, clarity, choice over and over again, you can see changes happening in your body. You can see changes happening within. So you can have changes like, your attitude changes, your personality changes, you become more positive. And change also means changing our lifestyle a little bit, because our mind and our body are interrelated. So whatever we do to our body affects our mind. Like, for instance, if we have a very poor sleep habit, like we watch TV or Netflix the whole night and we don't wake up early, that's going to affect our mental state. So choosing healthy habits, choosing a good sleep routine, having a good lifestyle, exercise, good diet, all of these factors actually help in bringing about the change. So these are the four C's.
Those are incredible forces, and I must say I do try to practice them, and you just laid them out in such a brilliant approach. I think I was doing it unconsciously, like after studying about it through mindfulness and breathing and a lot of training, but you really laid it out with such ease, the steps that we need for a healthy, proactive lifestyle where we make the choices, where we take responsibility, thus we are empowered to feel good along the way. And you have an incredible course that you have written for managing stress. It's called Stress Management Trainer Course. And it will be on the September 18th when it's going to be running. And could you tell us a little bit more about this course and who is this for?
Thank you. Yeah. So the stress management trainer course was actually developed in consultation with the British Society of Lifestyle Medicine. I actually thought of running a course because I did a course for the Royal College of Psychiatrists for health professionals, and this was known as the stress management course, which was just a one-day stress management course. But when I discussed this with the British Society of Lifestyle Medicine, they actually asked me if I could think of training up staff so that they would be more empowered to again share this with within their office, within their workplace. And that led us to bring about this stress management trainer course. It's a very simple one-day course, so it's tailored for health professionals because because the idea is it's actually more like a crash course, more like a one-day course. It's so a lot of information is packed up in one day. So we are not looking at just the general public. They're looking more at the healthcare professionals because they already have a lot of background information, background training, which helps them do this course, and then they're ready to go and you apply it in their work environment. So doctors, nurses, managers, occupational therapists, psychologists, social workers, all of them are welcome to do this course. And we actually the learning objectives of this course is to understand the stress mechanism and its long-term consequence. So in the course, I don't go too much in detail about the mechanism of stress, but actually just to help them understand with the help of practical examples. So we do a lot of, group exercises, case scenarios, and we learn about the different types of stress and its predisposing factors, particularly relevant to workplace. We identify stress at work, and we also focus on poor communication skills. So there is a segment where we talk about how to improve communication skills, and then we learn about strategies for managing stress at work. I also talk briefly about the basics of mindfulness and other evidence-based approaches or practices for stress management. So it's a one-day course, but it's quite laid back, it's quite relaxed. I've run two of them so far, and the next course is on the September 18th.
What I love about this course is actually that it's so practical that we can bring it into our workplace and apply it to our colleagues as well as our patients. Because nowadays everybody is burnt out. The pandemic has really brought its stresses. The workload, it just tripled for all of us, GPs and A&E and specialties as well. So we face a lot of difficulty in communication due to this burnout, due to this high stress. levels. And what I love about this course is that we have practical approach on how to communicate with our colleagues as well as with our patients. So I couldn't stress highly enough the importance of this course right now for all of us, healthcare professionals as well as patients. And if you would like to take the course, you can go on bslm.org.uk, go to events and look for the stress management trainer course. There will be a link on YouTube and on Instagram so that you can follow up on it. And do join us on September 18 for this incredible course that you can apply not only in your workplace, but in your private life, and give yourself and your environment a better opportunity to live a less stressful life. Thank you very much for joining me today. I would like to stress that every Friday I will be here on live at 9:30 on Fridays to address stress and to help everybody live a less stressful life. Thank you so much for joining today.
Thank you so much. Thanks a lot.
Amazing.